So first thing, you got to come close to this edge. And we're going to drape the person's thigh on the table, lower leg off the table. Okay? All we're going to do is pick up the lower leg. Okay? I'm not going to do that because then I bring into play the hip. So, keep thigh on the table, bring his leg up to terminal extension. Proximal hand is on the lateral joint line. Distal hand is just above the malleolus. I'm going to push the knee joint medially as I bring the lower leg laterally at terminal extension. Now the first thing, you got to make sure they're relaxed. He's relaxed, right? So now tighten your quad up. If he does that, am I going to get an accurate assessment? Because his quads are keeping the knee from bending, right? So that's hard to do for even people that aren't even injured. Sometimes to get them to relax. And if you're really truly injured and you think I'm going to hurt you, you're going to be even more guarding. So people, it's not as simple as I'm making this out to be. But if he doesn't relax, you can say, relax, kind of put your hand on the quads like that, or jiggle his knee, okay, to get them to relax. So then I'm going to push, stressing MCL, and I'm going to flex the knee to 30 degrees and do it again. Everybody good? So how I palpated the MCL earlier on the lab exam, he said ouch. Now I do this test, he's going to say ouch again. That's how you're going to determine that's what the injury is. So now you got to slide off the edge of the table, please. So this is now the varus adduction stress test. You got to actually come out just maybe 1 more inch and lay flat so you're relaxed. Actually, come out 1 more inch. Sorry. Okay, so same thing. Fully extend the leg, terminal extension. Proximal hand on the medial joint line, distal hand on the lower leg. I'm going to push the knee joint laterally as I bring the lower leg medially. Then I'm going to flex the knee. Can you feel the difference? Because LCL doesn't attach to the lateral meniscus. So you got a little bit of a wobble. Feel that? As long as that wobble is the same as on this side, that's normal. If there's a wobble on this side, but not on this side, does that tell me something? It's injured. Okay? Everybody good? So now you got to slide all the way up. Lockman test. And come just a little closer. Okay. I'm going to flex the knee to 30 degrees. I'm going to put my thumb on the joint line. Find the inferior pole of the patella. His doesn't have really good dimples, but it's right there. Can you feel? That's the tibia and that's the femur. The joint line is right there between my 2 hands. Stabilize the distal femur, grab the back of his leg, and I'm going to try to pull the tibia forward. And I'm feeling how far my thumb moved on those 2 bones. And I would say that's probably like 2 millimeters. Now, as long as that's 2 millimeters, that's normal, okay? But he's going to say on this test, ouch, that hurt. Where? He's going to say deep inside of his knee. Can I palpate ACL? No, it's intra-articular, right? So then that's the anterior translation. Now comes the end point, 30 degrees. Again, people say 30 degrees and they start to do it up here. You're going to get points deducted? You tell me the right thing, but do the wrong thing, you're not going to get full credit. So now, I don't have to put my thumb on the joint line. I'm just making sure the tibia is back, keep the femur still, and try to pull. And I don't have a real clunk, but can you feel that this wants to come to a nice stop? Right? If I don't feel that stop, right, it's mushy, that's telling me ACL potentially is injured. Are we good? The people, I'm making this sound very easy. This is hard to do. And if this is a 300-pound football player and you have little hands, are you in trouble? Yeah, you can't grab. So, anterior drawer. Foot neutral, 90 degrees. Sit on the person's foot. Grab the back of the leg. Sometimes I feel the hamstrings just to make sure they're relaxed. I'm looking at tibial plateaus, and I'm going to try to pull the tibia forward. enter a drawer. Next, pivot shift test. This is the way I do it. I'm going to lift the whole leg up. Internally rotate this whole leg. Hold it against my chest. Grab my proximal hand on the lateral joint line. I'm going to do the valgus force. I'm pushing that way as I bring his lower leg that way. And then I'm going to flex his knee. And right about there, it's going to sublux. And then, now it's sublux. When I do that, it's going to relocate. Now, he isn't torn, right? So nothing's happening. Okay? But that's how it would work if it's torn. Now, even if it's torn, it might not happen, right? But internally rotated, hold it against your chest, valgus force, and flex for that to happen. Okay, posterior drawer. 90 degrees, foot in neutral. Sit on the person's foot. Make sure he's relaxed. Now I'm going to push the tibia, lower leg, backwards. Next, posterior sag. Bring both feet up. Make sure both feet are perfectly parallel. I'm going to stand way over there. Look at the tibial tuberosities. Make sure they're on the same plane, level. If the PCL is torn, in theory, the tibia might be pulled backwards, passively. Quad activated. So you put this out of the way. In theory, if the PCL is torn, tibia can drop back. I'm going to sit on the person's foot. Now, if it's a big guy, I've got to make sure he's not going to catapult me off the table. All right, so I'm going to hold onto the table, but now just try to extend your leg. And so it's sitting on the foot, it's not going to move. But the tip quad's firing, it's going to pull the tibia back up. Okay, McMurray's test. You know where the joint line is, inferior pull of the patella. So put your hand on the lateral joint line, move it over to the medial joint line, back and forth, and you flex, extend, externally rotate, flex and extend, internally rotate, put a valgus force as I try to do all that. McMurray's. And then the patella apprehension test. And if his leg is straight, the patella quite freely moves because it's above the trochlear groove. Okay? But I want it to be in the groove. So you drape his leg over top of your leg, and now when I try to push his patella, it's more stable. But if I try to sublux it laterally, if he thought that was going to go over that lateral condyle, just fire your quad. It's going to pull it right back into the trochlear groove and say, don't do that. But then I'm going to also grab it laterally and try to sublux it medially. But most people have, if they have this problem, it tends to go lateral. Because the vastus lateralis is much stronger than vastus medialis. The Q angle, everybody remember Q angle from anatomy class? A line from the ASIS, the center of the patella, the center of the patella to the tibial tuberosity. That little angle. In men, it's 15 degrees. In women, it's 18 degrees. And why? Wider, larger in women.
Hips for birth.
Wider pelvis. Okay, is that good, ladies? Wider pelvis? Childbirth, right? Okay, that's the Q angle. Okay, it's almost time to go, but if you have